Hi, this is Kavita. Once again, I'm here with a totally different topic. So far in the previous videos, we were discussing about abnormalities of labor. Here, we are going to see about normal puerperium, or we are going to discuss what is happening to the mother immediately after the delivery. Puerperium is a period of 6 weeks immediately after the delivery of the placenta, that is after the delivery of the baby and placenta. From that moment to a period of 6 weeks, that period is known as the puerperium. In the normal puerperium, the body tissues will revert back to the pre-pregnant stage both anatomically and physiologically. That is, during the 6 weeks of period, whatever happens during the pregnancy, whatever changes that happen in the maternal body during the pregnancy, all those changes will revert back to the pre-pregnant stage. That is the puerperium. Already I have told you that in the puerperium or in the postnatal period, the maternal body will go back to the pre-pregnant stage both anatomically and physiologically. So here we are going to see what is happening to the body. So first let us see about the reproductive organs. And in that first we are going to see about abdominal wall. Actually it's not a reproductive organ, but this is the place where maximum change is occurring during the pregnancy. So first we are going to discuss about that. We know that during the pregnancy, the size of the abdomen will increase, even the breadth, width and length of the abdomen will increase, and you may feel as like it is coming up to the level of the chest cavity. So later, immediately after the delivery, if you are observing the abdomen, it will be soft and the muscles will be having less or poor tone. But later, within 6 weeks of after delivery, it will go back to the pre-pregnant stage, or it has to go back to the pre-pregnant stage. But it greatly depends on the exercises that the lady is performing. Sometimes you might have seen a lot of mothers with a big tummy even after 6 weeks of delivery. It is due to the poor exercises, or it may be due to the lack of exercises. So in the next video, surely I'll be discussing about the postnatal exercises that will help you to strengthen your abdominal muscles and which are helping you to regain your body shape. Next, we can see about the perineum. See, after the delivery, we know that in the perineal area, sometimes episiotomy stitch will be there, or sometimes wound lacerations, tear will be there, or minor lacerations will be there. And because of these things, and because of the high stretching effect during the delivery, severe swelling will be there, and engorgement also will be there. All these changes will start to subside or settle down within 1 to 2 weeks after the delivery. And even the wound, episiotomy wound, or if other tear or repaired wound is there, means that also will start to heal within 1 to 2 weeks. And the muscle tone of the perineum or pelvic floor also will uh, the lady will regain the muscle tone, but this also depends on the amount of exercise that the lady is performing. So in the next video, along with the I told you that I will be discussing about the postnatal exercise. Along with the postnatal exercises, I'll be teaching you the exercise that will help you to strengthen your pelvic floor muscles also. Next, if you are taking the uterus, actually the uterus is a pelvic organ. That is, it will be inside the pelvic cavity only, and its weight is only 60 grams and its length is only 7.5 centimeter in the normal case, that is in a non-pregnant lady. But during pregnancy, what will happen means it will become an abdominal organ. That is, from the pelvic cavity, it will grow, it will come up to the abdominal cavity, and later it will reach up to the xiphoid process of the sternum. And weight of the uterus will increase from 60 gram to 1000 grams. It will become around 1 kg. And length of the uterus also, I told you that the normal length is 7.5 centimeter. This also will increase up to 30 to 36 centimeter length. It depends on the size of the baby. And the endometrial lining also will become more thick. So these are the common changes that is occurring in the uterus during pregnancy. But after the delivery, what will happen means it will go back to the, or it has to go back to the pre-pregnant stage. So that process or that reverting process is known as the involution of the uterus. The uterus will become a pelvic organ, its weight will decrease and it will become around 100 to 200 grams, and even the length of the uterus also will decrease, and the thickness of the uterus, the uterine wall, everything will become normal. That entire process is known as the involution of the uterus. and the endometrial lining also regenerate. That is, after the separation of the placenta, a big raw wound will be there in the uterine endometrium. So that wound also will get repaired, it will heal, and normal endometrium will produce over there within 16 days. Immediately after delivery, if you are observing the uterus, the uterine fundus will be at or just above the level of the umbilicus. And within 2 weeks, it will come between umbilicus and symphysis pubis. And after 4 weeks, actually the uterus will become a pelvic organ completely, and you won't be able to feel it perabdominally. This is the thing that should occur normally. See here, this picture shows the level of the uterine fundus after delivery. Immediately after delivery, within 24 hours, this is the umbilicus. So it may be just above the level of the umbilicus, or it may be just below the level of the umbilicus. By 4th day, it will come up to here, and see, by 10th day, it will reach up to the level of the symphysis pubis, and later it will go back to the symphysis pubis, or it will go back to the pelvic cavity. Exactly. So you won't be able to palpate it no more. But sometimes nowadays, due to the use of oxytocin and other drugs which are helping for the contraction of the uterus, sometimes it won't take even 10 days. Within 4-5 days, if you are palpating, you can see that the uterus will go back to the pelvic cavity. And if you're telling about the height of the uterus in centimeter, immediately after delivery, I told you that it will be at or above the level of the umbilicus. And it is around 13.5 centimeter. And per day, 1.25 centimeter reduction will occur in the fundal height daily if it is contracting effectively, or if the process of involution is occurring effectively. 1.25 centimeter reduction will occur in the uterine fundus per day, and daily it will come down. So after the postnatal period, so in the postnatal period, it is the responsibility of a nurse to assess, or a doctor, whoever it is, when they are assessing the woman, it is the responsibility to assess the fundal height in order to make sure the proper involution of the uterus. And if the uterus is not getting involuted or not contracting effectively, there is a chance for bleeding, or there is a chance for, it shows that it may be due to the infection. Next, about the cervix. In a non-pregnant lady, or if you are not pregnant, the cervix will be circular in shape and it will be fully closed. And during the pregnancy also, it will be in the same condition. But during the process of labor, already I have told you that it will start to dilate, and it will dilate up to 10 centimeter. So it will be like a big circle. And later, after the delivery, what will happen means, due to that high stretching and dilatation, it may lose its elasticity, and later within 6 weeks it will regain that firmness and elasticity, and it will get closed. The 10 centimeter dilated cervix will get closed by the end of 2nd week, but it will never go back to the pre-pregnant stage. I told you that in the pre-pregnant stage it will be circular in shape, but after the delivery, even after first delivery also, if you are observing this cervix, it will be like a slit. It won't be round, it will be like a slit. And next is about the vagina. Within 3 weeks, it will go back. Immediately after the delivery, if you are observing the vagina, it will be edematous, or edema will be there, redness will be there, and increased blood supply also will be there. And towards the end of the puerperium, it will start to shrink. The vagina that is dilated during the pregnancy, it will start to shrink, and it will try to go back to the pre-pregnant stage. By 6 to 10 weeks, the vaginal epithelium, the normal epithelium of the vagina appears, and other changes that happened over there, the thickened epithelium, all those things will get atrophied or damaged, and the normal epithelium will be restored over there. And if it is a vaginal delivery, in order to regain the strength of the vaginal muscles, it is compulsory that you should do the pelvic floor exercise or Kegel's exercise. If you are performing the Kegel's exercise, it will help you to regain the strength of the vaginal muscles and pelvic floor muscles also. Later, it will prevent the urinary incontinence, because if you are having excessive laxity of the pelvic floor muscles, there is a chance for involuntary passage of the urine, and there is a chance for prolapse of the uterus. All those things you can avoid, and even if you are able to maintain the tightness of vagina, you will be having more sexual satisfaction also. But in the same way as like cervix, the vagina is also not going back to the pre-pregnant stage exactly, especially in the case of vaginal delivery. The rugae or the ring-like structure which are present in the vagina will get atrophied or will get damaged, and it will never go back to the pre-pregnant stage completely. And if you are going to the ovaries, immediately after the delivery, usually if the lady is breastfeeding, ovulation will not be there. But if the lady is not breastfeeding, within 27 days, sometimes normal process of ovulation will occur. Why this ovulation is not occurring in the case of breastfeeding mother means the high level of prolactin during the breastfeeding. See, for the production of breast milk, we know that the hormone prolactin is needed. Due to the high level of prolactin, it will suppress the ovulation and it will suppress the menstruation also. And if it is only moderate, within 6 to 8 weeks, the woman may get the normal ovulation and normal menstruation back if she is not feeding effectively. Here, actually, you might have seen that some of the ladies may conceive or get her second pregnancy immediately after the first pregnancy, within 2 weeks or within 2 months or within 1 month, she may get her next pregnancy. Actually, it is due to the poor breastfeeding. In their body, the level of prolactin may be less, and they may think that they are breastfeeding, so the prolactin may be there, so they may not ovulate, and they will go for the normal sexual intercourse without taking any precautions. So that may lead to the pregnancy. Next is about the changes in breast. Usually the breast will start to prepare itself for the breastfeeding. So the lactogenesis or the production and maintenance of breastfeeding will start immediately after the delivery of the placenta. After the delivery of the placenta, the level of placental hormones will decrease, that is especially the estrogen, and the prolactin amount will increase, and this increased amount of prolactin will help for the production of the breast milk and for the maintenance of the lactation. But if the mother is not feeding the baby, within 2 to 3 weeks, the level of prolactin will decrease and it will come to the normal level. And initially, for the first 2 days, the lady will be producing a yellow color fluid, that is colostrum. It contains protein, fat, minerals, IgA and IgG. That means it contains immunoglobulins, and it gives protection to the baby. So you are supposed to give it fully to the baby. And within 3 to 6 days, it will be replaced by the normal breast milk, and it contains protein, lactose, water and fat. The amount of immunoglobulins are there, but it is less when comparing with the colostrum. So it is important that you are supposed to feed the baby by the colostrum in order to get the proper immunity for the baby. Next, we can see the changes in the systems. If you are going to the circulatory system, during the pregnancy, we know that the blood volume will increase, the cardiac output also will increase. These changes are in order to get the maximum availability of food and nutrients and oxygen to the baby. So when the cardiac output is increasing, that supply to the uterus also will increase, and this will help to give more amount of nutrients and oxygen to the baby. But after the delivery, it will start to decline, and within 2 to 6 weeks, it will come back to the pre-pregnant stage. The blood volume will go back to the non-pregnant level within 10th day after the puerperium. Naturally, during pregnancy, the blood volume will be high and it will go back to the normal 5 to 6 liters within 10 days. Next, about the hematological changes or changes in the blood. The hemoglobin and hematocrit level will increase after the delivery, and the coagulation factors also will remain high for the few days, especially for the few days in the puerperium, and it will help for the prevention of bleeding and for the formation of clots, especially in the placental side. And it will come back to the non-pre-pregnant stage within 8 to 12 weeks after the delivery. Next is the lochia. It is the vaginal discharges for the first fortnight after delivery. It contains secretions or discharges from the body of the uterus, cervix and vaginal wall, and normally it is having a fishy odor and its reaction is alkaline, and later towards the end it will start to become acidic as like the normal vaginal secretions. And usually it will be there for 2 to 6 weeks after the delivery, and it is your responsibility to observe the characteristics of the lochia in order to identify the abnormalities. So you are supposed to identify the amount of lochia, color of the lochia and order of the lochia. And if there is any change, if foul smell is there or if any other if excessive amount is there, all those things shows abnormality. If excessive amount is there, means it shows the postpartum hemorrhage, or it may be a postpartum hemorrhage. And if foul smell is there, means surely it will be due to the infection, that is endometritis. Next, according to the color and according to the content, the lochia is divided into lochia rubra, lochia serosa and lochia alba. Lochia rubra is red in color and it contains more amount of red blood cells, leukocytes, decidua and mucosa, and this you can see for first to 4 days after the delivery. And lochia serosa is yellow or pale brown in color, and it mainly contains a mucus, serum and less amount of RBC and leukocytes will be there, and it can be seen for 5 to 9 days after the delivery. And lochia alba is pale white in color, and this also contains serous, exudates, mucus, epithelial cells and leukocytes, and this you can see for 10 to 14 days after the delivery. And if lochia rubra is persisting, it may be a bleeding or it may be a postpartum hemorrhage, and it may be due to the retained bits of placenta or maybe due to the subinvolution of the uterus. Already we have seen what is involution of the uterus, that is the uterus will contract and it will go back to the pre-pregnant stage both anatomically and physiologically. So subinvolution means it's if the process of involution is not occurring properly, that is known as subinvolution. So that subinvolution may lead to the postpartum hemorrhage. If lochia is having an offensive smell, it shows the infection and mainly it will be due to the E. coli. And if scanty or serous lochia, scanty serous lochia is there, means that is if the amount is less, it shows the streptococcal infection. And if suppression of lochia, that is if production is not there, it may be due to the obstruction of the internal os by the clothes. So these things you should see in the postnatal period. These are the major changes that will occur in the body in the postnatal period. In the next video, we will be meeting with the postnatal exercises and the postnatal care, or how to take care of the lady in the postnatal period or after delivery, and how to perform the postnatal exercises. Thank you for watching this video. Thank you.